Primary lung carcinomas are malignant neoplasms that arise from the cells lining the bronchi and bronchioles of the lungs. The major types of primary lung carcinomas are non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. Here's a comparison of their characteristic features, including etiology, pathogenesis, histomorphologic features, and clinical manifestations. Non-small cell lung cancer, NSCLC. 1. Etiology. Risk factors: smoking, the leading cause, exposure to secondhand smoke, asbestos, radon, and other environmental pollutants. 2. Pathogenesis. Genetic mutations, EGFR, ALK, KRAS, and ROS1 mutations are common in NSCLC. Cellular origin usually arises from bronchial epithelial cells. 3. Histomorphologic features. Subtypes: adenocarcinoma, squamous cell carcinoma, large cell carcinoma. Adenocarcinoma, glandular pattern, often located in peripheral lung areas. Squamous cell carcinoma, keratinization, often centrally located. Large cell carcinoma, poorly differentiated, lacks specific differentiation markers. 4. Clinical manifestations. Symptoms: persistent cough, hemoptysis, chest pain, weight loss, dyspnea. Prognosis: generally slower growing than SCLC, potentially operable at early stages. It is generally true that non-small cell lung cancer, NSCLC, tends to be slower growing compared to small cell lung cancer, SCLC. NSCLC tumors often grow at a slower rate and have a tendency to spread, metastasize, at a later stage, compared to SCLC. This difference in growth rate is one of the reasons why NSCLC is often diagnosed at a more localized stage, allowing for potentially curative surgical resection in some cases. Small cell lung cancer, SCLC. 1. Etiology. Strong association with smoking, almost exclusively seen in smokers. 2. Pathogenesis. Aggressive behavior, rapid growth, early metastasis, often diagnosed at an advanced stage. Neuroendocrine origin, arises from neuroendocrine cells in bronchi. Small cell lung cancer, SCLC, is so named because its cells appear small and round under a microscope. These cells are derived from neuroendocrine cells, which are specialized cells that have both nerve cell, neuro, and hormone-producing, endocrine, features. Neuroendocrine cells are found throughout the body and play a role in the regulation of various physiological processes. In the case of SCLC, these cancer cells originate from the bronchi in the lungs and exhibit neuroendocrine properties. This neuroendocrine origin is significant because it influences the behavior of the cancer. Neuroendocrine tumors, including SCLC, often secrete hormones or neuropeptides, which can lead to the development of specific paraneoplastic syndromes. Paraneoplastic syndromes are a group of signs and symptoms that occur as a result of the production of hormones or hormone-like substances by cancer cells, rather than the direct effects of the tumor mass or its metastases. These syndromes can cause a range of symptoms and complications in patients with SCLC, including hormonal imbalances, nerve and muscle disorders, and problems with blood clotting, among others. Certainly, paraneoplastic syndromes associated with small cell lung cancer, SCLC, can lead to a variety of symptoms due to the production of hormones or hormone-like substances by the cancer cells. Here are specific examples of the complications that can arise. 1. Hormonal imbalances. SIAD, syndrome of inappropriate antidiuretic hormone. SCLC cells can produce antidiuretic hormone, ADH, leading to excessive water retention, low sodium levels in the blood, and symptoms such as nausea, seizures, and confusion. ACTH, adrenocorticotropic hormone, production. SCLC can produce ACTH, leading to Cushing's syndrome, characterized by weight gain, high blood pressure, diabetes, and muscle weakness. Calcitonin production. Production of calcitonin can lead to disturbances in calcium metabolism, potentially causing fatigue, muscle weakness, and bone pain. 2. Nerve and muscle disorders. Lambert-Eaton myasthenic syndrome, LEMS. SCLC can lead to the production of antibodies that attack the neuromuscular junction, causing muscle weakness, difficulty in movement, and fatigue. Peripheral neuropathy, damage to peripheral nerves, can cause numbness, tingling, and muscle weakness in the extremities. 3. Problems with blood clotting. Venous thromboembolism. Cancer can increase the risk of blood clots, leading to conditions such as deep vein thrombosis, DVT, or pulmonary embolism, PE. Disseminated intravascular coagulation, DIC. SCLC can trigger DIC, a condition where small blood clots form throughout the bloodstream, leading to bleeding and organ damage. 4. Other paraneoplastic syndromes. Dermatomyositis, inflammatory muscle and skin disorder causing muscle weakness and skin rash.
Acanthosis nigricans, dark, thickened patches of skin often seen in skin folds, associated with insulin resistance and certain growth factors.
Hypercalcemia, elevated levels of calcium in the blood can cause nausea, vomiting, kidney stones, and altered mental status. It's important to note that not all patients with SCLC will experience these paraneoplastic syndromes, and the severity and combination of symptoms can vary widely from one individual to another. Management of these complications typically involves addressing the underlying cancer through treatments like chemotherapy, radiation therapy, and immunotherapy, as well as supportive care to manage specific symptoms and complications. The neuroendocrine origin of SCLC also contributes to its aggressive behavior and rapid growth. These tumors tend to grow quickly and have a high propensity for early metastasis, making them challenging to treat, especially if not diagnosed at an early stage. 3. Histomorphologic features. Small cells, small, round to oval cells with scant cytoplasm and finely granular nuclear chromatin. High nuclear cytoplasmic ratio, nuclei are large in relation to the amount of cytoplasm. 4. Clinical manifestations. Symptoms, often paraneoplastic syndromes, cough, chest pain, hemoptysis, weight loss, and respiratory compromise. Prognosis, poor prognosis due to aggressive behavior and early dissemination. Comparison and contrast, NSCLC versus SCLC. Etiology, both are strongly associated with smoking, but SCLC has a more profound and almost exclusive association with smoking. Pathogenesis, NSCLC often exhibits specific genetic mutations, whereas SCLC is characterized by its aggressive growth and early metastasis. Histomorphologic features, NSCLC has distinct subtypes, adenocarcinoma, squamous cell carcinoma, large cell carcinoma, with varied histological features. SCLC is characterized by small, round cells with high nuclear cytoplasmic ratios. Clinical manifestations, both types present with common symptoms like cough, chest pain, and weight loss. However, SCLC is often associated with paraneoplastic syndromes and has a poorer prognosis due to its aggressive nature and early dissemination. It's important to note that this is a general overview, and individual cases can vary widely. Advances in genetic profiling and targeted therapies continue to refine our understanding and treatment of these lung carcinomas. Patients are often managed through a multidisciplinary approach involving oncologists, pulmonologists, surgeons, and other healthcare professionals. Until recently, lung carcinomas were broadly categorized into two groups: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC, the latter encompassing adenocarcinoma, squamous, large cell carcinoma, and large cell neuroendocrine carcinomas. However, in 2015, the World Health Organization introduced a simplified classification, replacing the previous system. This division was historically significant due to the fact that nearly all SCLCs had metastasized by the time of diagnosis, making systemic chemotherapy the primary treatment option, possibly combined with radiation therapy. In contrast, NSCLCs were more likely to be operable and less responsive to standard chemotherapy. However, advancements in targeted therapies have emerged, specifically designed for certain oncoproteins present in a subset of NSCLCs, primarily adenocarcinomas and squamous cell carcinomas. Consequently, when ample tissue is available, NSCLCs undergo molecular analysis to assess the suitability for targeted therapy. Additionally, new immunotherapy methods, such as checkpoint blockade, have gained approval for a specific subset of NSCLCs and are undergoing testing for SCLCs. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale.
Message them on Instagram at Coffee First Cup to receive generous discount codes. That's a wrap for today's lesson.
I hope you found this video informative and helpful.
If you have any questions or topics you'd like me to cover, let me know in the comments below.
Don't forget to like and subscribe to my channel for more educational content. Take care, keep studying, and I'll catch you in the next video.